With the surge of the Delta variant and the new masking guidelines, there's so much changing with the virus. So joining us this morning is Dr. Ilan Shapiro, Medical Director of Health, Education and Wellness at AltaMed Health Services. Good morning, doctor. Thank you so much for joining us this morning.
Pleasure always to be with you.
So now that the state is requiring its employees to show proof of vaccinations, and other cities, including LA and Long Beach, are doing the same, do you think that will help?
I think that we need to have a layer effect, meaning that we know right now that vaccines work to the point that we're seeing right now that people are very, very sick and the hospitals and actually dying are people that are unvaccinated. That we know right now if we want to save lives in a preventable way, vaccines is the best way to do it. And people will nudge to, a mandate. People will actually nudge to actually just doing the correct thing. On my side, on the community, I can tell you for sure that last year was horrible. The beginning of this year was horrible, and we are preparing for the worst and hoping for the best that all of us as a community, we can actually prevent all the headaches that we know already what actually happened in summer 2020. The numbers are very similar, but the story is different. The story right now is that if you have actually a vaccine, you actually have more possibilities of not having the infection, side effects, going to a hospital, or even dying. And that's the important message that we need to convey to everybody.
Yeah, I hope everybody hears it. Well, we're hearing about more and more breakthrough cases. So how concerned do vaccinated people have to be about the Delta variant?
Well, it's a great question. Right now here in the U.S., we have Pfizer, Moderna, and Johnson & Johnson. The three of them have high protection possibilities for all of us, but none of them are 100%. Then if it's 90, you still have a 10% probability of getting infected. Then the more cases we have, and that's why it's so important right now to start doing, masking all of us, because that way we're actually creating more barriers between us and the infection and reducing the possibilities of all of us of getting sick. The advantage of actually being vaccinated, it's not actually just taking out the mask. It's actually making sure that you will survive an infection that can actually create a lot of side effects and a long problem and a huge list of long COVID issues that we're seeing with a lot of patients that survive COVID.
We are certainly wearing our masks here at ABC7. So for many students, it's back to the classroom next month, and now all students will have to wear a mask regardless of being vaccinated. So tell us why this is so important, and what can parents do to get their kids to comply?
First of all, I'm going to answer as a father and as a pediatrician. My kids, and we all know that actually kids need to be at school, and that's the best way for them. And we need to create a lot of layers. Why? Because we still have a big group of kids that are not vaccinated, not because they don't want to, because they are less than 12 years old and there's no vaccines for them. Then creating a lot of masking inside of the school for teachers, administrative officers, actually, and parents creates a better way of protecting our kids. That is the most vulnerable part of our communities. And that's why, the American Academy of Pediatrics actually going out there and putting, mask on. If you're 2 years or older, put it on, and that actually can help you actually create and mitigate the infection.
Right. It's been a pleasure. Dr. Shapiro, Medical Director at AltaMed Health Services. Thank you so much for joining us, and have a great day.
Thank you.